joining us from. So please, could you put that in the chat and say hello and let us know where you're joining us from? And we can give you a shout out. Except the speakers, of course, because I know where you guys are. So tell me where you're joining from. Can everybody hear me?
Yes.
Fantastic. Great. Okay, while you're all doing that, okay, welcome Shaki from Durham. Can anyone do better than Durham? Manchester, woohoo. Is it raining there? As it always is. Hi, evening, Middlesbrough. Nice, thank you for joining. It's not raining yet, okay. Well, it rained here in London this morning, so let's see what happens. Famudu from Nigeria, welcome. What part of Nigeria are you joining from? Where specifically? Thank you. Lagos, all right, yes. Welcome. Now, if there's anyone you think should be here, please send them the link and let them join. We've got Hello from Lagos as well. You are welcome. So, for those, I can see some new names, new faces who might not have been here before. So let me introduce myself. My name is Flora Coker, and I'm the founder of Encapsulate Healthcare Solutions. And the organization was set up to empower our people in terms of health information so that they could make better decisions about their health. And we also run a program where we train and educate healthcare professionals to improve their skills in the area of wound management. So welcome, Prince D from Birmingham City. Welcome. Thank you. Anyone else? Oh, who else is there? Josephine, Staffordshire. Thanks for joining. All right. Our time is gone. There's lots of information to share. Please stay engaged. And if you do remember to share the link to someone who should be here, maybe you invited them, they've forgotten, just send them a reminder. I'm going to go straight to Dr. Simi Sola. Go for it, Simi. Over to you.
Okay, hello everyone. I'm just going to share the screen so you can see the presentation. Oh. Okay. Can everyone see the screen?
Yes, well, your notes full.
It's with the notes.
Sorry, guys.
David Tucker, thanks for joining. Let us know where you're joining from in the chat while we're waiting for the slides to come up. We did test this 5 minutes ago, but technology would like to do its own thing. It's trying to say nobody must say yes.
Literally. Okay.
Hello, sir. Joining from Mr. Abdullah, joining from Ikorodu. Thank you for joining. Yes, we can see it. Go for it.
Lovely, thank you. Okay, so hi, hope everyone is doing well. So today we will be talking about oral health. So many people think oral health is just about having white teeth and fresh breath, but the truth is your mouth is connected to your entire body. So that's your heart, your brain, and sometimes, and most times even your blood. So today we'll be speaking about how to protect your teeth, prevent disease, and hopefully you'll leave understanding why a healthy mouth truly means a healthy body. Okay, so a bit about me. So yes, my name is Simi Sola. Some people call me Simi, and I am a dentist based in London, and I'm also the founder and CEO of the nonprofit organization Budding Black Dentists Network, CIC. So during my dental foundation training in the NHS, I underwent some leadership programs. So I've obtained the level 5 diploma in leadership and management, as well as a healthcare leadership scholarship. So in regards to my clinical experience, I have exposure to general dental practice, community dentistry, oral surgery, and oral and maxillofacial surgery, which is surgery of the head and neck. Okay, so a bit about Budding Black Dentist Network. So it is a registered non-profit organization based in the UK that aims to improve Black representation in the dental workforce and the dental curriculum. So here's some of the work that we do. So some of the work that we do includes hosting mock interview workshops and personal statement checking services as well for dental applicants. We also promote diversity and inclusion in the dental field, and we speak at schools about dentistry as a career and also the importance of maintaining good oral health. So we also give educational talks like we're doing today, and we host social networking events for dental students and dentists within the Black community. We also offer one-to-one mentorship for dental applicants and dental students in the UK to support them on their journey to becoming dentists. Okay, so I'm just going to hand it over to the co-founder, Aliden Viney, Dr. Aliden Viney.
Hello, everyone. Thank you for joining. As my colleague and friend, Dr. Simi said, my name is Aliden. I am the co-founder of Budding Black Dentist also. And I manage the outreach team, so where we go into schools, go into communities, share about oral health and also education in how to get into dentistry as a career as well. I'm currently a general dentist working in the UK as well, and I completed my National Health Service Foundation training in London as well. I'm currently in 2 practices and just doing all general dentistry, including fillings, extractions, root canals, everything like that. And I have also undertaken some further training in cosmetic dentistry, so things including moving teeth via aligner treatment and different types of composite bonding treatments as well. So we've just got some objectives that we hope we would have achieved by the end of our time with you. We want you to be able to understand how your daily oral hygiene can prevent you getting tooth decay and gum disease. Both of these diseases are preventable. So we'll be going through and explaining how what you can do at home to help prevent these things. We'll also be teaching about the causes of tooth decay, common high sugar drinks in the diet and foods. Also, we'll be teaching about how you can recognize poor oral health and also how this can actually affect the rest of your body. As Dr. Simi said, it can affect your heart, blood sugar levels, so which contributes to affecting diabetes and also sickle cell disease. We'll also be going through normal oral changes in the mouth versus signs that in the mouth that actually require you to seek medical attention or go to a dentist. And we'll also be going through common myths in the oral health that are likely to have been going around, which we will hope to debunk. So before we get into any information, we've just got a poll, just some questions we'd like you to please fill out. So we'll be putting the link in the chat. Alternatively, you can scan this code if you have a smartphone, and that should take you to the link also. Yeah, if you've been able to get into the link, you can put a thumbs up.
Just let us know what the code is again. Ask it for a code.
A code with the link.
Yeah, I'm the QR code. Just pop the code in the chat if possible. I think you had it on this previous slide.
Yeah, so the link, yes, that should be in the chat, and then the QR code on the screen.
Has the QR code been showing the whole time?
Yes, that's
Oh,
fine.
yeah.
We just need the code for the Mentimeter.
Yeah. So that should be in the chat as well. Oh, the code, yes. Yes.
Yes, please.
Yes.
If you're on Mentimeter, just give a thumbs up so we know that you've accessed it.
Okay. So,
This is QR code is working. And then
okay.
we can enter the
All
code.
right. So this is the code.
Mhm. It hasn't come up yet. It's just showing the QR code.
Oh,
In the
yeah.
okay.
So is that 8269, yeah?
Yes, 8269-7549. Okay, interesting, interesting. Okay, just going to hear from a few more people.
If you've got in, just put your thumbs up, then we can. I've put the code in the chat. So once you get a Mentimeter, just enter that code and we'll let you in so you can vote. We've got 25 people on here. Let's have some more responses, please. Thank you, Elizabeth. Before we go to the next question. Anyone having trouble accessing it? Just let me know in the chat and then we can assist you. Give it 1 more minute or so. It's going up. Question is on the slide. The most important time to brush is in the morning. True or false? Okay, you have some answers in the chat, LED, so you can add it to the results.
Okay. Thank you. I'll keep a note. That's okay. I'm going to go on to the next slide.
It'd be great if you could get out to Mentimeter though, so we can see it coming up on the screen. Thank you for answering in the chat. That's fine.
Yes, please.
All right, 10 more seconds. Okay, you've changed.
Oh, sorry, yes.
No, go. That's fine.
Okay. So the next one is we should brush twice a day. Okay. Lovely. Okay. This is good. This is good.
More answers in the chat, yeah?
More answers in the chat. Okay. Yeah, if you can go on to Mentimeter, that would be great. Just so we can compare. We're going to do a poll at the end as well with the same questions just to see if anything changes. And it'll be nice to compare the answers. So if you can go on Mentimeter, that would be great. Okay, I'm going to go on to the next slide. So black gums are abnormal. So black gums aren't normal. And I put in quotation black, but you know what I mean. Okay. Okay. Thank you. Thank you. And then fresh juice does not harm your teeth. Okay. Thank you, everyone. And you should change your toothbrush every 3 months. Okay, there's more people now. Lovely. Okay, I'm going to go on to the next slide. You only need to see a dentist if you have pain. Okay. All right. Lovely. I'm just going to see the chat as well. Okay. So we've got false, true, no, false. Okay. We've got some varied answers. And bad oral hygiene does not affect heart health. Lovely. I think there was a clue at the beginning of the presentation as to whether it does or not. Lovely. Wait for maybe one more. Okay. Yeah, okay. So someone says it can, and someone has said false. Lovely. And diabetes can affect gum health. Okay. Interesting. Okay. And then I would say this is the last one. So if I have no teeth, I do not need to see a dentist. Okay, so if I have no teeth whatsoever, there's no point seeing the dentist. Okay, yeah. So a few people in the chat has said true. Okay, yeah, true, 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 true. Okay. All right then. So that's the end of the presentation. I'm just going to go back to Zoom. Thank you guys for participating. And okay. So leading it over to you.
Yeah. Thank you. Okay, so I'm just going to go through a list of simple practices that you should be doing if, as the slide says, you don't want to lose your teeth. Okay, so if you remember nothing else from today, just remember at least these things that I'm going to go through now. So you should be brushing your teeth twice a day. The most important one is at nighttime. The reason for this is because all throughout the day, obviously you've been eating, you're building up food debris, bacteria. So you need to clean that all away, otherwise it's going to be harboring in the mouth, on the teeth, and on the gums. So ensure you're, getting your nighttime brushing in. You also want to be using a fluoride toothpaste. This number 1350 to 1500 ppm is shown on the back of the toothpaste bottles. So tube, sorry. So this just indicates the amount of fluoride that is in the toothpaste. So you want to be looking for this amount as an adult. This is the amount that we recommend adults should be using in their toothpaste. You should be brushing for 2 minutes. This is to ensure that you're cleaning all surfaces of the teeth, you're doing it properly, you're getting the gums and everything like that. After you brush, you should spit the toothpaste out and do not rinse your mouth. This is because the toothpaste needs time to go inside the teeth to actually work. Okay, so just see it like cream when you're moisturizing yourself. You don't go and rinse it off again with the shower. It needs that time to absorb and go inside the skin. You also need to be cleaning in between the teeth. Okay, so we'll go through what things you can use to do that. This is because using your toothbrush, it's not getting anything that's stuck, any plaque stuck in between the teeth. It's just getting the outer surfaces of the teeth and the gums. Then also you want to be cleaning your tongue to remove any bacteria from the tongue, which can usually lead to bad breath. And if you want to use a mouthwash, it's not compulsory. If you do want to use a mouthwash, you should use it at a different time to brushing. So you want to wait about half an hour after you brush, half an hour, because then the toothpaste has had adequate amount of time to work in the teeth and in the mouth. So for example, you can use the mouthwash after a meal, or something like that, but mouthwash, it does not replace brushing the teeth. The reason for this is because plaque, which is what naturally forms on everyone's teeth and in the mouth from bacteria, food, and saliva, it's a sticky sort of film that covers your teeth. Now, water or mouth rinse doesn't take this off. It needs something to mechanically rub it off. That's why you're using a toothbrush or something like that, or floss, to remove this plaque. And then on top of this, you should be visiting your dentist regularly. So most people will be every 6 months, or whatever, recall has been agreed with your dentist, then you should be going to see them. Um, and it's mainly because we're not just checking, for problems, we're also trying to see if there's any detections of early signs of any sort of diagnosis or pathologies, diseases. Um, and we also screen for any sort of cancers as well in the head and neck region as well. So usually lumps, bumps, things like that. So that's why it's important you visit your dentist regularly. Next slide, please. Okay, so we'll just go through some specifics for your oral hygiene. So to clean in between your teeth, you want to be using floss. Now, floss will be cleaning the teeth surfaces. Your teeth touch most people. And so you need to clean the plaque off of the teeth itself. As well as this, some people might have spaces between the gums, the teeth, especially people with gum disease. And for this, you need to use the interdental brushes. These are the small brushes that you can see on the screen. So ideal situation, you should use the interdental brushes and the floss. This will clean the plaque from the gums and the teeth. If in some cases the small interdental brushes will not fit in between the gums, then you just use the floss and you can take it under the gum to clean out any plaque that's stuck under the gum. Just a thing to mention about toothpicks, wooden sticks that you might use to, clean in between your teeth. They can damage the gums because obviously it's wood, usually a bit sharp. You can get splinters, sort of things in the gums. It also doesn't clean the gums adequately. Usually doesn't go all the way through to clean it out. So it might take a bit of the food out at the front, but it's not going all the way in between the teeth, which is what the floss and the interdental brushes will be doing. Okay. Now for the toothbrushes, you should be changing your toothbrush every 3 months. If it's electric brush, then change the head every 3 to 4 months. You don't actually need a very hard brush to have clean teeth. It's all about the technique, which is what we'll go through in another slide. So a medium, soft to medium bristled brush is absolutely fine. And you also, if you're using a manual brush, you want to try and use a small head brush. So like the electric brush is very small, try and get a manual brush that's quite small head. This is because you need to get around the corners of the mouth adequately. You don't want to miss any surfaces of the mouth. So it's just a bit more precise and accurate in getting difficult to reach areas in the mouth. Brushing hard is not necessarily for you to have clean teeth. Like I said, it's all about the technique. It's not about how hard you're brushing, how often you're brushing. It's about getting the right technique, and that's what's actually going to clean your teeth. Now speaking about the tongue, so like I said, the tongue harbors a lot of bacteria on there, which can lead to bad breath, or professionally, clinically known as halitosis. So you can use these tongue scrapers to clean off the tongue. Some people use the toothbrush. You just need something to clean the bacteria off the tongue. A lot of the causes of bad breath is from this bacteria that is sitting on your tongue. Make sure you don't scrub it too aggressively, because then that can irritate the gum. It can cause it to get a bit inflamed, and can affect your taste buds, which are usually found on the tongue as well. I know there's usually a lot of news as well about oil pulling, which some people do to try and take care of their oral health. From our research, we have found there's limited evidence at the current moment to know the effectiveness of oil pulling as a dental hygiene routine. So I cannot necessarily recommend it, but I do know that some people are using it. Yeah. Next slide, please. So if you have dentures, this is the false teeth that some people wear. You should be removing it every night. This is because your gums, the mouth, it needs, time to breathe, it needs time to heal, time to have full contact with the saliva, which has, helps to keep up the oral health of your mouth. You also want to clean the denture with a soft brush and soapy water. You can soak it in a denture solution to have that deep clean. You don't need to do that every day, but once or twice a week is fine as long as you're cleaning it with the soft brush as well. Even if you wear dentures, even if you just have 1, 2, 3 teeth, you should still see a dentist. If you have no teeth, you should still see a dentist. And like I said, it's about us screening for any signs of, head and neck cancers early, as well as, checking the oral health of your mouth at that current state. Next slide, thank you. So just a bit about diet and your oral health. We'll start with sugar. So as we can see, our beloved Supermalt and Fanta, we can see, over 8 teaspoons of sugar in these drinks. Now, based on the National Health Guidelines in the UK, they say that you should have about 7 teaspoons of sugar as your daily recommended amount. So Supermalt, Fanta already goes over your daily amount of sugar that you should be having. The reason why sugar is an issue is because this is what leads to decay. The holes that you find in your teeth that you usually can get pain sensitivity from. So the way to combat this and manage this is you want to try to have 4 what we call sugar attacks a day. So anytime you have you eat food, anytime you drink, most of the time it has sugar in there. So whenever you have this, this is attacking the teeth or the mouth with sugar. So 4 sugar hits would usually be 3 meals and maybe 1 snack. You want to try and have any juice, anything like that with your meal, and then it'll count as 1 hit of sugar. If you leave it about an hour and you sip a drink and then another hour, sip a drink again, this is all hitting the teeth and the mouth with sugar. So now you're increasing the amount of sugar attacks that your mouth is having. When this happens, then the mouth can't actually manage and cope with the amount of attacks of the sugar. And that's how you can get decay in the teeth. And as well as this, some foods are acidic, especially a lot of fruit, quite acidic. This can also be damaging to your teeth because it can wear on the enamel, which is the outer surface of your teeth. That can lead to sensitivity and pain as well. Okay. Just something to know, we should be aware of any hidden sugars and natural sugars. So hidden sugars are in things such as ketchup, things that might seem kind of healthy, like a breakfast bar, granola, some instant porridges as well will have hidden sugars in there. Some dairy products like yogurts and processed foods, baked beans, ready-made sauces, and drinks. Okay, so even fruit juice, it has natural sugar in there. Smoothies, it has natural sugar in there. So there's still sugars that can contribute to decay. They're not exempt from contributing to decay. Okay, so just be aware of, what you're eating. When you're eating, it's best to have it at one time rather than spreading, you're constantly snacking or you're constantly sipping throughout the day. So like our point says, frequent sipping is worse than just having your drink at one time. Next slide, please. So we're now going to show you a video from our friend, Dr. Yuande, and she's going to go through how you should be brushing your teeth. So this is with a manual brush and also an electric brush.
There's no sound.
Hey, Simi, are you able to get any sound on?
Okay, while we're getting that sorted out, if you have any questions, please pop them in the chat. We'll take them after the speaker. I've seen one question already. If you have any more, please do pop it in the chat and then we'll take them afterwards. And if you've just joined, you're welcome. Let us know in the
Really
chat where
well?
you this from. Yeah.
Because a lot of plaque can build up here, so make sure you're spending enough time brushing this area. I know a lot of people are often in a rush when they're brushing, but it's so important to have an order to it. You can see again, I'm doing the biting surfaces. This is where you're constantly chewing every day, so it's easy for food to get trapped here. And then moving on to the inside again, focus on the inside here. This is where you have a salivary gland, so the plaque can harden into calculus. So spend a good amount of time brushing this area. And don't forget, last but not least, to brush your tongue, because this helps keep your breath fresh. Good job, guys. Now moving on to electric toothbrush. So you get your electric toothbrush and place it along your gum line at a 45-degree angle. Again, I usually start at the back. Then you switch it on, and it's going to feel a bit weird at first, but trust me, it's a game changer, because all those movements, it already does it for you, so it makes your life easier. All you have to do is gently move it along. It can be tempting to move it back and forth, but it's doing the work for you. So ideally you should be spending around 4 to 5 seconds per tooth, okay? But just make sure you're spending a good amount of time, because I know it can be difficult to count all the time. Just don't be in such a hurry. As you can see, I'm going on to the biting surfaces like before. A lot of people ask whether electric toothbrush is better than a manual toothbrush. They can both be equally as effective if you have a good technique with your manual toothbrush, but again, it just makes life a whole lot easier, which is why I personally use it and I recommend it. So as you can see, I'm doing the inside surfaces along the gum line. Again, it's so important to get the areas behind your lower incisors, because this is where a lot of plaque can build up and harden up into calculus. And if you don't remove it, you're going to need it professionally cleaned. So make sure you're doing a good job at home with your brushing, okay? Spend at least 10 seconds behind that area. That's what I do. And then once you're done, you can spit out if it's building up, the saliva, and then move on to the top. So then again, 45-degree angle along the gum line, removing all the plaque that's building up there. So the toothbrush that I'm using on myself is a £30 electric toothbrush, whereas the one on the model is worth £100. I feel like in terms of price, just get whichever one suits your budget. The more expensive ones usually just have better features such as pressure sensors and more functions, but honestly, if it does the job, that's the main thing. So just get one that's in your price range. I noticed that a lot of people brush too hard. So getting an electric toothbrush with a pressure sensor can be a good investment if that's you. You only need a small amount of pressure, not too much, but not too little. As you can see, I'm systematically working my way around, and it's so important to have a good order because it makes sure that no tooth is missed out. So you can see here, going along the inside again, if you notice that your gums feel quite sore, quite sensitive, or you see bleeding, this can be the first sign of gum disease, which is gingivitis. So just make sure that you're keeping up a good oral hygiene routine, and you should see the bleeding reduce over time. So that's it, guys.
Okay, thank you. So I'll just go over a few points that Dr. Yuande made. So when you're brushing, what I like to say is just focus on your gum line first. A lot of people miss the gums. So like she said about this 45-degree angle, it's just placing your brush diagonal onto the gums. Part of the brush will be on the gum, part of the brush will be on the teeth at an angle. And then you just want to do, if you're having a manual brush, small circular motions along the gum line. Where the gum meets the teeth, where it touches the teeth, that's where you need to be putting your toothbrush. If you're using electric brush, you don't need to do any circular motions. Just hold the brush there and it's going to be turning and cleaning the plaque away for you. Okay, and then after the gum line, the outside and the inner side where your tongue is, where the top of the mouth is, make sure you're getting your brush right to the back of the gums. Then you can focus on the actual teeth. So it's two separate things. You're doing the gum line and then you're doing the teeth. One's against gum disease and the other is against decay in the teeth. With the teeth, just make sure you're getting all the surfaces of the teeth. Think of it like a box, trying to get the side, the top, the other side of the teeth. You don't need to scrub hard, like we said, it's just about getting this right technique. If you see any bleeding, like she said, it usually is a sign of gum disease or gum inflammation. With consistent cleaning using the right technique, that should calm down, should subside. But you also might need some further treatment with a dentist as well. Okay, so now I'm going to speak about caries, which is, like I was saying earlier, decay or the holes that you can get in the teeth. So this is caused by the sugars and the bacteria which is in the plaque that sits on the teeth. So plaque naturally develops on the teeth. It's from bacteria, saliva, food. It just forms that sticky film like we mentioned earlier. Now, the bacteria in your mouth, which naturally occurs in your mouth, will feed on these sugars and then it releases acids. And the acids is what causes the holes in your teeth. It's like it's eroding the teeth away, eating away at the teeth. This is also known as demineralization. Okay, so the main factors you need for decay to happen is the sugar, the bacteria in the mouth, which is naturally occurring in the plaque, and then time for this to happen. So that's why you want to be really good at controlling how you're having the sugar with the sugar tax, and also make sure you're cleaning the plaque away, which is getting rid of that bacteria being able to feed on the sugars. Next slide, thank you. So now we'll go on to talk about gum disease. So both of these diseases are preventable. It's all about what you're doing, your routine, how you're eating, how you're brushing. And that's why it's so important for us to know what to do. You can prevent yourself from having these issues. So periodontal disease, or also known as gum disease, is an infection or inflammation of the gums. So usually signs of inflammation is puffiness, might have bleeding, might feel a bit itchy, it looks a bit swollen, shiny kind of gums, rather than a sort of flat, matte kind of color to your gums. Now, gum disease can cause bleeding. It can cause your gums to shrink away, which is also known as receding gums. And ultimately, it can link to you losing your teeth. Because what happens is the bacteria in the plaque, it goes under the gums if it's not cleaned away properly. Then what happens is if it's now under the gums, your brush isn't really reaching there. That bacteria then goes further down into the bone and it eats away at your bone. And that's what we call gum disease. Now, the bone is what is supporting your teeth, it's holding it there in place. If you're losing bone, your teeth will start to become wobbly and then your teeth can also fall out. You can also get infection from the bacteria under the gums, pain, swelling and things like that. Usually, we call gum disease a silent killer. You might not feel pain initially. You might not see anything happening initially until it's in the very severe stages. So that's why it's very important that you go and see your dentist regularly so we can check if you have any signs of gum disease. Now, just a bit about smoking. If you're a smoker, you're 2 to 3 times more likely to develop gum disease compared to a non-smoker. And a lot of the time, being a smoker will actually mask or cover up the effects of gum disease. So you might not actually see bleeding in the gums. And this is because the harmful elements in the, cigarettes, it actually constricts your blood vessels. It tightens them. So you actually won't, it doesn't allow healing. It doesn't allow the air to flow with blood and circulate. So you might not actually see a lot of bleeding if you're a smoker. The ingredients in cigarettes also affect your general biofilm, so the bacteria in your mouth, it affects that and it makes the bacteria and the plaque more harmful. So then obviously the damage is going to be worse now because it's sort of combined with the elements in the cigarettes. Because of this, your gum disease can actually then progress much faster and to a much more severe stage, much quicker than a non-smoker. Yeah, so now I'll hand over to Flora.
Thank you so much, Dr. L. Eden. Let's show her some appreciation. That was a great presentation. Thank you so much. Let's use our emojis and show some appreciation for our first speaker. Thank you, thank you, thank you. All right, just stop sharing the screen for 1 minute so we can all see each other. Okay. Right, first question. Is mouthwash safe? Now, I don't know if Derimo, you want to elaborate on that question because it can mean quite a few things. I'm just looking for you to unmute. Could you just unmute and just expand on that, please? Thank you.
Hey, thank you very much. I'm a pharmacist by profession, and I have a lot of dentist friends, and they actually have dental practices, and they tell me that they wouldn't recommend mouthwashes out there because a lot of them are alcoholic, and they themselves they don't recommend it for their family. So why do we have mouthwashes? I know that there's some fluoride ones that in case of mouth disease and stuff like that, people can use fluoride. But even then, I'm a bit skeptical about using fluoride right now after everything that I've heard about, fluoride poisoning and stuff like that. So, yeah.
Sorry, I was
Go
off.
for it.
Thank you. Yeah, it's a very good point. So I agree with your dentist friends. I don't necessarily recommend mouthwash. It's not needed per se. Apart from, like you say, some mouthwashes treats, target certain things. So there's some mouthwashes for gum disease. It will just help with the inflammation of the gums, help things to feel a bit more settled, and then allow you to actually carry out the actual oral hygiene that you need to clear away that bacteria and that plaque. It's more so an extra thing that some people might use. You want it to be non-alcoholic and fluoride containing to kind of have benefits in the teeth. So it's just an extra dose of fluoride that some people like to use, or some people like to use it to rinse the debris of food that's built up in the mouth. Because, like I said about the brushing, if you're over brushing, you can be wearing at the enamel. So an alternative might be, okay, I've eaten food, there's food in my mouth now, in between my teeth, and you can use the mouthwash to sort of rinse your mouth. But alternatively, you can do a warm salt water rinse. You can use normal water as well. So it's it's just an extra thing. It doesn't replace any sort of brushing or flossing, and at the same time, a lot of people don't need it. So it's very sort of, I would say, case specific as to the patients that I recommend to use it. It's very specific.
Thank you.
Thanks. Next one. Well, I'll take two in one. When should the toothbrush be changed? And can the same toothbrush should it be used to brush the tongue? Should the toothbrush be used to brush the tongue?
Okay. Yeah, so you should try and change your toothbrush head every sort of 3 to 4 months. And you can use the toothbrush to clean the tongue, the same one. You can. But like we said about the bacteria is harboring on the tongue. So let's say ideal situation, you'd have a different toothbrush. Alternatively, it's the tongue scraper. So that would just be cleaning tongue bacteria off directly, and then your toothbrushes, you're just using on your teeth and your gums. But I understand some people might not have the budget to go and buy all these 3, 4 different things. So at least use your toothbrush that you're using on your teeth, at least then to use on the tongue if you're not able to get all these other bits of equipment.
Did you answer about when your toothbrush should be changed?
Yeah, so
Yeah.
3 to 4 months. Sorry if you missed it. Yeah.
All right. Next question. If a 2-year-old is brushing twice a day, but would not allow his tongue to be brushed, and when he opens his mouth, person said they can perceive some smell, what do you suggest can be done?
I would say one thing is trying to encourage them to do it. So find fun ways, rewards maybe if they let you brush the tongue, or they can watch even educational videos and they should be copying at the same time. Another thing is them when they watch you sort of do it together, like it's a family thing. So you're doing it at the same time, or you do it on them. You have a go. Oh, let's have a go on you now. Let's encourage them doing it as a joint sort of effort. Another way, some parents have to actually lie the child back, so maybe on the bed or something like that, to get the mouth, fully open, and do the best you can with brushing the tongue. If you're perceiving bad breath, a good thing as well is to use like a warm salt water rinse. You can put it on a cotton bud, something like that. Try and rub it on the tongue if you can, or even try and get to the tongue maybe just after they've eaten or something like that, when their mouth is open. But worst case scenario, if you really can't get to the tongue, they're really not letting you, it's not the end of the world. Like you have the bad breath, it's not the end of the world. A lot of kids around that age, toddlers, they are fighting their parents to try and clean. So you just do the best you can. You do as much as you can. If things are getting worse, just take them to the dentist as well. See if the dentist can help you to encourage them to brush. But it's not the end of the world. It's very common among toddlers. A lot of them, they're not able to brush the back teeth, the tongue properly, a lot of things like that. I would say as long as you're still trying to control the diet and everything like that, then hopefully they won't get any sort of diseases till they're a bit older and you can do things properly.
We'll give you a break. There's some more questions, but we'll come back to them at the end, okay?
Okay.
So let's go to Dr. Simi next. Carry on the presentation. Thank you. Oh, it came off. It's gone off again.
Yay. Yeah, sorry, I'm just sorting that out.
No.
Okay.
If you've just joined us, thanks for joining. Let us know where you're joining us from. And we are just about to start with the second speaker.
Okay. Hi, everyone.
Yes.
So, yes, I will be talking about the link between your oral health and the rest of your body. So I'm going to start by the link between heart disease and your oral health. So bacteria from gum disease can actually contribute to the buildup of plaque. So plaque was spoken about by Aleden. So it's like, I'd say it's kind of the debris, all the food, that starts to kind of stick on the teeth over time. So this can actually be traced in the bloodstream. So the bacteria and all this debris can actually enter into the bloodstream, and the body responds to this by producing inflammation. And this inflammation can actually affect blood vessels. So research has shown that bacteria from gum disease may play a role in the narrowing of blood vessels. And so there's a name for this condition, and it's called atherosclerosis. So taking care of your gums actually reduces your risk of this. And people with severe gum disease have been shown in studies to have a higher risk of heart disease, stroke, and other complications involving the heart. So, for example, a heart attack. So, essentially, what this means is that in reducing your gum inflammation, this actually lowers bacteria in the bloodstream. It reduces chronic inflammation and also supports oral health, your overall, heart health. Okay, so this is relevant for us Africans because hypertension has been increasing in the population over time. So it's good to know the link between your oral health as well as heart disease. Okay, so the link between diabetes and your teeth. So we're going to speak about gum disease again. I'd say gum disease has, significant links to the rest of your body. So gum disease, as I've mentioned, is a chronic infection. So when I say chronic, it's just another way of saying a low level ongoing battle in the body. So the body responds to this by producing, leading to inflammation, basically. So like I mentioned before, this inflammation releases chemicals into the bloodstream. So these chemicals can actually make the body more resistant to insulin. So those who are diabetic will know what insulin is, but insulin is a hormone that helps control blood sugar. So when the blood sugar levels are high, the body's ability to fight infection becomes weaker, healing becomes slower, and there is more sugar in your saliva as well. So this feeds the harmful bacteria in the mouth that I even spoke about previously, and then it causes problems in the mouth. So in short, poorly controlled diabetes can actually worsen gum disease, and then gum disease, the other way around, can actually make diabetes harder to control. Okay. And sorry, I've also mentioned that dry mouth is actually a symptom of diabetes. Yeah, there's a great number of diabetic patients who actually have dry mouth. So with dry mouth, it actually increases your risk of decay, because if there's more saliva in the mouth, then that can actually, it kind of rinses off the plaque that's sticking onto your teeth. Okay, so there's emerging research that suggests that bacteria linked to gum disease may also be linked to brain inflammation. So while the research is ongoing, I have to say it's not research where we can say there is a definite link, but it just reinforces the importance of prevention of dental disease, just so you can increase your risk of having problems when it comes to dementia. Okay, so we're going to talk about the link between sickle cell anemia and teeth. So sickle cell trait is found in 1 in 4 West Africans. So signs and symptoms of the sickle cell anemia, it can vary between individuals, but some of the systemic symptoms. So when I say systemic, by the way, I'm talking about how it means something that affects the entire body rather than a single area. So some of the systemic symptoms when it comes to sickle cell disease include pain and susceptibility to infection. So oral infections can actually trigger systemic complications and pain crises. So preventing dental infections is extremely important for individuals with sickle cell. All right, so we're going to play a game. So this game is called Normal or Not. So I'm going to show you guys a series of pictures. I don't know how, Flora, probably if I'm missing anyone, just let me know. But what I want you to do is, actually, I think it'll be easier if you put your thumbs up if you feel that a certain image that I'll point to is normal, and a thumbs down if you feel the image is abnormal, meaning there's something that might be going on, or some kind of disease or condition going on. Okay, so I'm going to start with this picture first. So as you can see, it's a darker, you've got darker gums. Some people refer to them as black gums. So a dark brown presentation of gums. Sometimes it comes up purple as well. So would you guys say this is normal or not? So for normal, put your thumbs up. For abnormal, not normal, put your thumbs down. So you can react via the, you should have reactions in the chat.
We have mostly thumbs up and a couple of thumbs down.
Okay, a couple of thumbs down. Okay, lovely, lovely. Okay, interesting. Okay, so this is actually normal. It's actually normal. So I don't know if you, you guys should know that this is actually, if you see that there is symmetry with certain things in the mouth. So here you can see that all the gums are dark. So all the gums associated with all the teeth are dark, meaning this is actually normal. So this is actually a normal presentation in darker skinned individuals. So it's good to know that. And so I'm going to go into the next picture. So we've got some, we call it pigments, but this is like the coloration. It's like a different color. That's what we call pigmentation, and it comes from melanin. So we've got some pigmented areas on the tongue. So would you say that this is normal or abnormal? This is the second picture. So we'll just put thumbs up or thumbs down if abnormal. Okay, yes.
Kind of 50-50 for up and
Yeah, I can
not.
see, yeah. Interesting. Okay. All right. So guys, this is actually normal. So even though there's no symmetry, as I said, we have melanin in darker skinned individuals. So some of this melanin that we have can actually present in the mouth, and it can also present on the tongue. So this is actually a normal tongue. However, if you're noticing changes that are just over time, so most people will have this maybe from birth or from a young age, but if you're noticing that these changes are coming about all of a sudden, and it's constantly changing within a short period of time, then definitely see the dentist or a doctor if you can't get to a dentist. Okay, so would you say this image here with the darker areas on the gums, would you say this is normal or abnormal? Okay, so thumbs up for normal, thumbs down. Okay. See, Shakir said thumbs down. Ikuoma has said thumbs down. Just put thumbs down. Elizabeth put thumbs down.
Yeah,
Okay,
mostly
thumbs
thumbs down.
down.
One normal, only one normal, but everyone else thumbs down.
Okay, all right. So this is actually normal. Once again, it's pigmented areas due to the melanin that's found in dark-skinned individuals. So sometimes this can present as well. But as I mentioned with the tongue, I'd say the same applies to this area here because there's no symmetry. Okay, so we've got, okay, I'm going to go to this picture here. So it's the bottom left picture with, yeah, the dry lips, the grayish area in the lips, but then you can also see a darker area around the mouth. Would you say this is normal or abnormal? Okay, Darren has said it is normal. Okay. Yeah. So I'm seeing mainly normals. Okay, Evelyn has said abnormal. Okay. So this is actually abnormal. And I'm going to speak about this later on, but this actually develops if you lick your lips too much. So I'll speak about that later on. But it's called lip lickers dermatitis. Okay, so we're going to go into the next image. So it's the bottom image in the middle. So would you say this is normal or abnormal? And you can put your thumbs up or thumbs down. Thumbs down, okay. Thumbs down, yeah. Okay, majority is thumbs down. Okay, yes, you guys are right. So this is called angular cheilitis. I will go into it later on in the slides that I will that I'll be presenting next. But yeah, this is actually abnormal. So if you see this, you do need to go to the dentist or the doctor, and they will prescribe you something to help with this. And then we have the last picture here on the right. So would you say this is a normal presentation in the mouth or abnormal? Okay, so thumbs down, okay. All right. So what I'm asking you to say whether it's like abnormal or normal is the whitish, grayish, faint color that's associated with the inside of this cheek. Okay, Thomas said abnormal. Okay. All right. So this is actually normal. This is a normal presentation, and this is found in many darker skinned individuals. I'll say around 90%, including myself. So I'll speak about that later on. Okay, so black gums or darker pigmented gums. So this is common in individuals, as I mentioned, with darker skin tones. It's caused by the natural melanin pigment. It's similar to the differences in skin color. So obviously there's certain presentations on darker skin individuals that you may not see or present differently in our white counterparts. So this is one of them, it's our gums. So it may show itself as brown or dark purple. So it's usually symmetrical, which is how you know whether it's abnormal or not. And no treatment is needed because this is just a normal, these are normal gums. So yeah, no management is needed. Okay, so the inside of that cheek. So this is called leukodema. So it's usually found on both of the inside of the cheeks or on the inside, the skin on the inside of the lips. And it usually shows up as a faint white, grayish thickening. So as I mentioned before, it's very common in people of African descent. Usually around 90% of people with of African descent have this presentation. It disappears when the inside of the cheek or the lips are stretched. So this is a key feature to know whether there's something abnormal going on or not. So it's considered a normal variation of the inside of your cheek or the inside of your lips. So no treatment is needed. However, I would say maybe if you're concerned that, it's changing over time, there's the discoloration is changing over time or something, is still best to see the dental doctor if you're still concerned. But this is very common in people who are more dark-skinned. Okay. So we've got angular cheilitis. So I've shown two pictures here. So sometimes it can show up as very light pink in dark-skinned individuals, or we've got this dark brown purplish color as well. So these are cracks or sores at the corners of the mouth. So this can be caused by saliva pooling. So sometimes if you're licking your lips a lot instead of moisturizing them, you are actually creating an environment for a fantastic environment for the bacteria to just stay there, and some fungi as well to just stay there and cause issues. So you're creating a great environment for them if you're licking your lips with saliva instead of moisturizing your lips with a suitable cream. So the risk factors are dry lips, ill-fitting dentures as well. So if your dentures aren't fitting very well, it actually collapses your mouth more. And so you get more pronounced corners for the saliva to actually sit, your own saliva to sit in those corners and allow there to be a good environment for the bacteria and the fungi to cause issues. So if someone doesn't have dentures that fit well, you have a risk of developing this. Also, if you have vitamin deficiencies, I think a lot of people don't know this, but when I see patients in clinic and, I see them present with something like this, then I would refer them to get bloods done to see if they have any deficiencies. So, as mentioned here, if you have iron deficiency or B12 or folate, then you can be at risk of developing something like this. Also, systemic illness as well can lead to this. Can be a risk factor for this. So this is more common in infants, the elderly who may be wearing dentures, and immunocompromised patients. These are patients who their body, because they're quite ill, their body doesn't respond well as someone who, doesn't have certain medical complications or anything like that. So it can make you more at risk of developing something like this. So treatment is, instead of licking your lips, moisturizing your lips. Also correcting the underlying cause. So if you have vitamin deficiencies, then having vitamin supplements would be good. And also you can have something prescribed as well. So it can be topical means you would just put it on the area. So it can be as a cream, a topical cream, for example, and it'll be antifungal or antibacterial. Or you can have it combined. There's creams that also combine the two. Okay, so white spots on teeth. So some people, they do find white spots on their teeth. So sometimes it can't be, so it's not very clear what's going on, but it could be early decay and it could be enamel hyperplasia. So that's just the incomplete development of the enamel on your teeth. I would say usually it's so with the hyperplasia, so the incomplete development, enamel develops very early on. So very early on in childhood. So you will usually have these not stains, but these white spots very early on, and then it kind of sticks with you as you grow older. the early decay white spots, that's caused by the bacteria, the sugar, and the time that Alida spoke about. So if your teeth are basically demineralizing, as Alida explained before, it shows up as these white spots prior to actually becoming the hole that you find in your teeth. So I've just shown an image of the early decay and how that represents. So these are what the white spots look like. Also, another sign is if you can kind of see that around those areas, it's looking like there's disease going on. So you can see there's gum disease. And yeah, you might see some bleeding gums as well. So this is most likely not developmental. It will be most likely early decay. So definitely see the dentist early for the early decay, so it doesn't actually progress to become a cavity, so a hole in the tooth. And early decay can actually be reversed with fluoride. So do see the dentist as soon as you can, if you suspect this, or if you see the white spots. Okay, so I'm just going to speak about oral cancer. So we recommend seeing a dentist if you notice any new lumps, bumps, or changes in color inside your mouth. So if something has gradually changed in size, shape, or appearance, it's always best to have this checked. So I mentioned that prior as well. So if you're unsure, it's definitely best to just get things checked by the dentist, just so your mind is at rest. And the earlier oral cancer is detected, the better the chances of successful treatment. So if you're in doubt, definitely go to the dentist or a doctor. I'll say dentist because the dentist usually, they'll know what to check and what to look for in the mouth. So things to look out for: ulcers. So these are maybe sores that you might see in the mouth that aren't healing within 3 weeks. So if you see that, definitely go and see your dentist. Color changes as well. So we usually would say that red and white patches are signs, I'd say red warning signs that you need to go and see a healthcare professional. You need to see a dentist just so they can double check these patches, and they may just refer you for further investigation. So I mentioned previously lumps or thickening in the mouth as well. So lumps on the tongue, inside of the mouth, or on the neck as well. So we actually, when you see the dentist, I believe Leland spoke about this prior, sorry, Dr. Leland has spoken about this, but we actually check your neck. So we check inside the mouth as well, but then we check for lumps and bumps in the neck as well, because that's also signs that there might be something sinister going on if we feel a hard lump in the neck. Other symptoms is numbness, persistent hoarseness. So if you feel like your voice has kind of changed, it just sounds more hoarse, then definitely go to your dentist as soon as you can. Difficulty swallowing as well. I'd say the hoarseness, if it's around, usually if it's 6 weeks, I would say. And then, if it's 6 weeks, then yeah, definitely see your dentist, because it might be more, it could be more than just a cold or flu that you have. Also difficulty swallowing as well, definitely see your dentist. And also unexplained loose teeth. So if you don't have gum disease or any history of gum disease or anything like that, and then suddenly you're getting unexplained loose teeth, then that could be a sign that something sinister is going on. Okay, so also I've just got images here. This is how you can check. So this is quite a good image showing how you can check visually. Check your own mouth. So as you can see, there's the inside of the gums. You're checking, sorry, the inside of the lips. You're checking the gums here. You're checking the inside of the cheek. You're checking the palate. So that's the top part of the mouth. You're also checking the back of the throat. So that's where the tonsils are as well. Underneath the tongue, I have to say, underneath the tongue is a common area where we find oral cancer. So definitely check underneath the tongue and on the sides of the tongue as well. Okay. All right. Lovely. Okay. So debunking myths. So I just wanted to kind of finish here. I feel like I'll get a few questions from this, but a myth that I know that a lot of people go by is if it doesn't hurt, it's fine. So people will only go to the dentist if they are in pain. That shouldn't be the case. Because nothing preventative can be done if you're already in pain. That's when treatment comes in. But a lot of dentists are very heavy on preventing disease, so you don't get to the point of having to do something irreversible like taking a tooth out. So definitely go for checkups with the dentist. So yeah, something irreversible doesn't have to happen, like a tooth being taken out. So good teeth or bad teeth runs in my family. That's a common thing that I hear with a lot. So many patients. If you're brushing, if you're doing everything that Dr. Leiden had mentioned prior, then you should be good if you're going to the dentist at least twice a year as well, but also just taking on that oral hygiene regime, then you should be fine. It's not a case of good teeth, bad teeth, runs in the family. I understand I mentioned in regards to diabetes, that uncontrolled diabetes can, lead to gum disease and things like that. But sorry, can increase your risk of gum disease. However, you reduce that risk by having good oral hygiene. It's not a case where you're going to have gum disease, or, if your enamel hasn't developed properly and you're more susceptible to decay, it doesn't mean you're necessarily going to get decay. So this is another lie. And next one is, brushing harder cleans the teeth better. Please, you don't have to brush your teeth hard. Literally, just like Dr. Leiden said prior, a soft bristled toothbrush should do the job. And if you actually brush your teeth very hard every single day, twice a day, you're actually rubbing off the enamel, and that's the white surface, the white outer surface of your teeth. So your teeth will actually start to look yellow because you're actually brushing off all that white, the white aspect of your teeth until you get to the yellow bit, which is dentine. And with that, you can't get the enamel back. So you probably have to get your teeth whitened or something like that. But just please don't be brushing your teeth too hard. Chewing sticks are better than toothbrush. Okay, so with the chewing stick, I remember my own grandma used to have chewing sticks. I'd always see it in the drawer as well. I have to say, the bristles of a toothbrush, it makes sense mechanically in regards to scrubbing the plaque off your teeth. The chewing stick, even though I feel like it's pretty much like a hard bristled, it's like you're scrubbing with a toothbrush really hard. With a chewing stick, it's usually made of a material that's quite abrasive to the teeth, so it's actually quite harsh to your teeth. So we wouldn't recommend it. Based on studies as well, the toothbrush is more effective. So I'm going to go to the next one. So fluoride is harmful. So Dr. Leiden spoke about this, I believe. So fluoride is only harmful in excess amount. So I think I was doing research, and you have to swallow more than 10 tubes of toothpaste to be poisoned by toothpaste, as in all in one go. You have to swallow 10 tubes of toothpaste all in one go for it to be harmful. And fluoride is naturally found in tea. It is naturally found in milk as well. So if you feel fluoride is harmful in regards to the amount found in toothpaste, then you should probably cut tea and milk out of your diet as well. So that's just something to know as well. Bleeding gums are normal. So Leiden's already spoken about that. Bleeding gums are normal. You should maybe rethink your oral hygiene regime if your gums are constantly bleeding, and definitely see a dentist as well, and just so they can control gum disease. And the mouthwash replaces brushing. Yeah, so we spoke about mouthwash prior. Mouthwash does not replace brushing. There's the mechanical removal of plaque when you are toothbrushing. Mouthwash just kind of throws on some fluoride onto the teeth. But yeah, it cannot replace brushing. Okay, so we've got another poll here. Let me see if I can show the results as well. Okay. Let's see if I can get the code. Mm.
Is it the same code?
Oh, pardon?
Is it the same code?
No, it's not the same code. I'm just getting it now. Okay. So the code is, I'm going to put it in the chat actually, then I'll show it on the screen.
All right, just pop your questions in the chat. It will take after this.
Okay. So is it?
So just call it out and I'll put it in the chat door.
Yeah, sorry. Yeah, I did say that. So it is 3472.
3472.
Yes, and
Mhm.
then 48. Sorry, I can put it in the chat. Don't worry. I'll put it in the chat. I've just copied it.
Mhm. It's showing the one from previous.
Oh, it is.
Mhm.
I think the questions are the same actually. So let me see if, yeah, the questions are the same.
All right,
So
just pop the QR code back on again, please.
yeah, that's fine. Let me stop the first and then.
So we should all get everything right this time, right?
Should
If we've been listening.
be the case. That should be the. I have to say, I was quite surprised. People did well. There was just the odd few. Yeah, that wasn't going with everyone else's responses, but people did well. So yeah, this is the QR code, and then yeah, is it okay to show the results?
1 second. I think
Oh,
we
sorry.
haven't put the link in the chat yet for the post presentation.
Okay.
I'm just gonna do that now. All right, so the link is in the chat, or you can scan the QR code and you've got the code there. So let's do the poll. Okay, go ahead.
Okay. I'm just gonna do the responses. We're gonna start. Okay. Start presentation. Okay. So resume. Sorry guys, I'm gonna show it on this. Yeah.
Mhm.
Okay, chart now.
Yeah.
Okay, lovely. Okay, so the most important time to brush is in the morning. Okay, so I'm going to give the answers for this one as well, because we finished the presentation and if people are getting it wrong, I don't want them to leave with wrong information. So, okay, so the most important time to brush is in the morning. Okay, so guys, it's actually in the evening. Aliden, I don't know if you want to go over why it's in the evening.
Yeah, I will. So, evening is the most important time. The reason being is because you've eaten all throughout the day, the bacteria's been harboring in your mouth throughout the day, the plaque has built up in your mouth throughout the day. So you need to clean that all off before before you sleep. Because now you're gonna have the most bacteria, the most damage can be done now at the end of the day. Also, when you're sleeping, you actually have less saliva as well in your mouth, so it can't actually kind of clean. Saliva kind of cleans and heals things in the mouth, so it can't actually do that job as effectively at nighttime. So you want to make sure all that plaque and bacteria is removed at night before you go to bed, so it's not sitting on the teeth and the mouth throughout the night, because that's when it will be doing the damage.
Thank you. I'm going to go to the next slide. We should brush twice a day. Okay. There's a straggler there. Someone has said false. I'll be intrigued to know how many times the person who's put false. I don't know if you can unmute or I don't know if you'll be able to unmute or put in the chat. How many
They don't
times?
actually want to reveal themselves.
They
Okay.
probably
Is
don't
the other
actually.
one?
I've just
No, the one that
that's
says
true.
false,
I'm just okay, yeah.
and you want to
Let's not.
explain why, just
Yeah,
raise your hand and then we'll unmute you. So we'll ask you to unmute, then you can explain, or you can put it in the chat. Or if you want to remain anonymous, then okay.
yeah. Yeah, I'll let Lyndon take this one. This is part of her slides.
Yeah, so you should brush twice a day. Twice a day is enough. Like I said, you need that nighttime brush and then another time in the day. So most people's morning because you wake up, your breath smelling, things like that. But doing it more than twice a day, a lot of the time, it's not needed really. It's just not needed, and you're wearing on the enamel on the tooth surface, you're wearing on the gums. Um, and so it's just excess brushing, excess force and frequency that, can actually lead to more damage than good. So twice a day is enough, just using the right technique, doing it for long enough, the 2 minutes, and getting, like I said, the gum line separate to the teeth. So you're definitely cleaning the plaque off of both aspects of the mouth.
Okay. So black gums are abnormal. So black gums aren't normal. They are a sign of disease. It means something's going on. That's what the question means. I'm sorry, that's what the statement is saying. There's something bad going on. Okay. All right. So majority have said false, and you guys are correct. Yeah, so black gums are normal in darker skinned individuals. Okay, so fresh juice does not harm your teeth. Fresh juice does not harm your teeth. I don't know if people are also mentioning in the chat that answers. Yes, it can. Okay. Lovely. Okay. Yeah, we have more people responding. Yes, so false. Fresh juice can harm your teeth because it's acidic. So it can damage your teeth. Okay.
And it has the natural sugars as well.
Yes, and it has natural sugars. Thank you. And you should change your toothbrush every 3 months. Okay. That's true. Lovely. Okay, I think we repeated this a few times because someone had asked in the chat as well. So yeah, this is good. This is good. And the next one, you only need to see a dentist if you have pain. Only if you're in pain. Don't see them. If your teeth are doing fine, you're brushing twice a day, you're good. That's what the statement is saying. Lovely. Okay. All right. So a lot of people put false, and rightly so. This is false. So people who have no teeth still need to see the dentist, for example. People who aren't in pain still need to see the dentist as well. The thing is, you can detect certain oral problems early on, even when there's no pain going on. So it doesn't become an issue where, you have to have rigorous treatment, or we can stop gum disease from progressing as well. Examples of that, or decay, we call it arresting, but stop early decay as well from progressing as well, if you see the dentist often. So not just when you're in pain. So I'm glad everyone has learned from that. And bad oral hygiene does not affect heart health. Lovely. I'm liking the speed. It's like people know. People know. what the answers now, what the answers are now.
Okay.
So prevention is better. Thank you so much. Prevention is better as well. Sorry, that was for the previous slide, but yes, I would say in all areas of healthcare, prevention is much better. You don't want to be having treatment that could have been prevented. Generally, yes, it can affect it. Yes, well done, guys. Okay, got false for that. Diabetes can affect gum health. Okay. All right. And people in the chat, yes, yes, yes. Lovely. Thanks, everyone. So people are listening. Okay, and then got the next slide. So this is the last one. If I have no teeth, oh, we spoke about this actually. If I have no teeth, I don't need to see the dentist. Okay. All right. So yeah, if you have no teeth, you still need to see the dentist. Okay, so I'm seeing, I'm glad that there's people not following the sheep. There's people who are sticking to their guns, and I like that actually. That's a good sign of leadership. Great leaders. Yeah, it's actually false. If you have no teeth, we would still need to check if you have signs of oral cancer, for example. If there's lumps and bumps in the mouth that you may have not seen yourself, the dentist might see something that may need further attention and further investigation. So yeah, I'd say that is that for the poll. Thanks for everyone who participated. I'm just going to share the PowerPoint again. Yeah. Okay, can everyone see the PowerPoint?
Yeah.
Lovely. Okay.
Yeah.
So that is pretty much it. That's us done. So yeah, I just wanted to say thank you guys for tuning into the presentation. We've just added our socials, how to contact us if you want to contact us. So we have an email address. We have a website as well. So that's www.buddingblackdentist.com or .co.uk. Our Instagram as well, where we post all things oral health really. We're also posting oral medicine things. So literally the slides where I spoke about things that are common in darker skinned individuals, for example, the darker gums and the leukodema as well. You'll find that on our Instagram page. We just found that there's not much out there when it comes to the presentation of things found in the mouth when it comes to dark-skinned individuals. It presents differently compared to white counterparts, for example. So we like to show this on our social media platforms. And we also have TikTok.
Awesome. Thank you. Thank you, Dr. Simi. Let's show some love. Before we go to questions, let's show our appreciation for Dr. Simi. Thank you so much. That was fantastic. Great, 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 great. Yes, awesome. Right. So I'm just going to spotlight both of you because both of you will be answering the questions now. And before we do that, I have put the link for the feedback form. Please fill it in. It's always short, as you know, I always make it short. We would like to know your thoughts, your feedback, how we can do better, and what was fantastic, which it was. Just let us know what you think. Please do complete it. The speakers really want to know. They're always asking me for the feedback, so please try and do it. Even while we're doing the questions, you can be doing that. Yes, we've got a comment fab job, ladies. Thank you, with a heart. That's all the way from Manchester. Has it started raining yet? It wasn't raining at the beginning of the webinar. Has it started raining yet? And yes, lots of thank yous and so on. So let's start with something. Oh, it's still not raining. You see, it's because we're on. Once we stop, when we finish, it'll start raining. Thank you, Imani, saying awesome, ladies. Well done. All right, let's start with something light. This toothpaste. I don't know why people love it so much. You probably know the one I'm going to ask you about. Okay, you guys guess. Let me see if you get it right.
Youthmol.
Yes. And it's the lady from Manchester asking. I don't know what has to do with the rain there too. So she loves Youthmol and she wants to know your thoughts about it. Yes, no, maybe.
I'll start and then maybe Dr. take over.
Looking for the exact question. Go on.
Youthmol toothpaste, a lot of them don't contain fluoride, which we recommend, to use to protect your teeth. The fluoride in the toothpaste is helping to remineralize your teeth. So that means any damage that the acids from the sugar, the bacteria has done to the teeth, the aim is to try to sort of regenerate and protect the teeth again with the fluoride toothpaste. So a lot of Youthmol toothpaste don't have it, so you have to really check. I think there's only one that I've seen that has it in there, and then all the other ones don't. And so yeah, if you're someone that has diet sugar in your diet, hidden, natural, anything like that, then that fluoride toothpaste is a benefit for you. So yeah, I don't recommend Youthmol a lot of the time.
Dr. Simi, any thoughts to add to that?
Yeah, so there are some Youthmol toothpaste out there now currently that do have fluoride, funnily enough. Yeah, but I think they're slowly coming out. But it's known that Youthmol doesn't have fluoride in it. So yeah, I'd usually stay away. If there's a toothpaste without fluoride, then I'd say it wouldn't be as effective.
Okay, great. So next question is, what's the best toothpaste to use for a child over 6, the age of 6?
Over 6. So if you look, most of the toothpaste, like if they should have like an age range on there. If not, look on the back of the tube. As long as it has 1000 ppm above, then that's fine. That's the one you want to use. So they can use up to an adult toothpaste as well, because it's over 1000 ppm of fluoride. You just want to use a pea-size amount. So you don't need to be using a whole. You know how the manual toothbrush, a lot of them are quite big and people spread it all across. It's too much. You don't need that amount. Literally, like the size of the electric brush, how it's very small round head. You just need that pea-size amount on the brush for a 6-year-old. And then encourage everyone should be just spitting the toothpaste out. You don't rinse your mouth off. So yeah, encourage them spit and don't rinse with that toothpaste.
Yeah.
Okay.
Also, a smear amount for very young children is good. So like literally just smear it on to the toothbrush instead of a whole pea-sized amount. But yeah, I find that a lot of kids, when I was working with a lot of very young children, the parents would complain that the child will swallow the toothpaste. So I think just be careful. If they are swallowing the toothpaste, add very little fluoride. But make sure they see the dentist as well, because they can give a certain fluoride, you call it fluoride varnish, but they can coat the child's teeth with a certain fluoride that just stays on, that's quite sticky to the teeth. So it's unlikely that they will swallow that. So if they're seeing the dentist often, then they can get that bit of dose of fluoride. If you're quite hesitant, yeah, if you're just scared that they're swallowing too much, yeah, definitely just go to the dentist, let them know your concerns and things, and yeah, just decrease the amount by a bit.
Okay, Dairy, Mo, I've asked you to unmute. You had a question about fluoride. I'm not sure if you heard when Dr. Simi covered it, but go ahead. About your
Yeah.
daughter's teeth melted white, yeah.
Yes, and she was told at the dentist that it was because when she was younger, she used to mostly swallow the toothpaste. So I don't know how far true that is.
Yeah. Would this be linked to like fluorosis or
Yeah.
yeah, okay.
Yeah,
Yeah.
so it's a condition known as fluorosis, usually seen, in young children if they swallow too much toothpaste as the teeth were developing. And so it gives like a white kind of snowy, like
Yeah.
towards
like a
appearance. Yeah.
yeah, like very fine. I mean, very white compared to the rest of her teeth. She's in her 30s now. She's a bit conscious about it. So I don't know. She was suggesting if she wanted it whitened or whatever. Yeah.
Yeah, so that's what we'd recommend. If it's because of fluorosis, that yeah, whitening would help to correct it and sort of
Okay.
remove the differences. There's two kind of conditions that appear like a white mark sort of thing on the teeth, or it looks whiter than the other part of the teeth. So one is
Mm,
fluorosis, that's from ingesting too much fluoride as the teeth were developing, and
mm,
another one is just called hyperplasia. So it's just like Simi mentioned in the PowerPoint,
mm,
it's
mm.
just when the teeth are developing there's a bit of disturbance in the development of the enamel. That
S-
can give like a white speckled or brownish marks on the teeth as well. Um,
Okay, so it's not that it's being demineralized or anything like that.
y- that's no, that's more to do with decay and things like that.
Okay.
Yes,
Okay.
the white spot from decay, that's demineralization.
Different. Okay.
The white spots where it's when the teeth are developing, so
Right.
developmental changes of the enamel, that's either
Right.
fluorosis or the hyperplasia of the
Okay,
teeth.
so how come fluoride is, I mean, there's a school of thought that it's dangerous. So there's some toothpaste that don't have fluoride in it, and there's some that are saying, oh, you need to have fluoride, especially with children. I have a grandchild and I'm not sure. I mean, she uses Aquafresh, the 2-year-old one, but I'm very, I'm just confused right now
Mm,
about whether to get her non-fluoride toothpaste or
mm,
fluoride toothpaste.
mm. I'll speak a bit on it and then Sim, you can join in after.
Okay.
I would say that, like we mentioned in the PowerPoint, we do recommend the toothpaste with fluoride,
Hmm.
mainly because it's helping to protect your teeth and remineralize the teeth. Like I said, decay is caused by sugars, and most of the food that people eat, even
Hmm.
toddlers, you're giving them, even bread has sugar. So
Hmm.
I think the cases that I've seen where the parents don't, yeah, they don't agree with fluoride and they're not giving fluoride toothpaste, all those children have actually had decay. And it's because a lot of
Hmm.
the time they can't even control what they eat. They don't even have a very super healthy diet where they just eat veg and do you know what I
Hmm.
mean? So you're having sugars in your diet, but then there's nothing because they can't really clean as well.
Hmm.
And then on top of that, there's nothing really helping to prevent and prevent the decay from developing from the sugars. A lot of the time they
Hmm.
get decay. So the fluoride is helping to protect the teeth and remineralize the teeth.
Okay.
Like I said, if they're taking in too much of it, then yeah, it can be an issue. You want to sort of really decrease the amount you're putting on the toothpaste.
Hmm.
Under 6, like Simi said, just a smear, like a
Yeah.
ribbon. Um,
Yeah. Yeah.
over 6, you do a pea size.
Keep going. Okay.
Um, but it seems from research and then also from just like my clinical experience that it's doing more good than
Okay.
yeah.
Okay.
Um,
Thank you.
yeah, there's not sort of long-term studies that are against the toothpaste. A lot of them are for the fluoride in the toothpaste rather than against fluoride in the toothpaste.
Okay. Thank you.
Dr. Simi.
Fab. All right, you talked about whitening. Now, as we know, there's a big industry out there.
Hmm.
So, what are your thoughts about tooth whitening? When is it appropriate to have it done? Should you have it done? Go on. Yeah. Who's
Should I?
going to take that first? Yeah, go on.
I think Simi is on mute as well.
Thank you. I think Aliden's, you've done teeth whitening.
Yeah, yeah.
Yeah, Aliden's the best person.
Yeah, I've done teeth whitening.
Yeah.
Um, we only offer it to patients that have a very stable mouth condition. So that means your gum disease stable, healthy. It's not, you don't have gum disease, you're not getting decay. Everything needs to be stable and healthy in the mouth before we offer it to patients. It's only for adults as well. So in the UK, it's over 18. Um, and yeah, it's good to it's nice to enhance, what you have. Um, it also means that a lot of the time when people get whitening, they don't actually opt for other treatments as well because it's the main thing you see when you see the teeth. If it's a bit whiter, it changes the appearance of the way the teeth look as well. So yeah, we do offer it. It's a good thing to have cosmetically. But in the same breath, if someone's not concerned cosmetically, you don't need to go through that because the way we do it here is you take these trays home and gels. So you have to do it at home. You have to sort of be consistent with a routine to get the teeth whitened over time. We don't do like an in dental surgery whitening where it's sort of like they just do one session with whitening and then you leave, which some countries do that, but a lot of the time you leave with very sensitive teeth after that one. So the treatment that we offer for whitening is given to you to take home. We show you how to do it and how to use it, but it slowly whitens the teeth from the inside over time. But yes, just a cosmetic procedure enhances what you have. So yeah.
Any situations where you'd not advise teeth whitening? Like,
Um,
why do people want to do it, and then when, which situation would you say no?
yeah, most people want to do it just because of the way the teeth look. So just get rid of that yellowish kind of tinge to their teeth, which naturally your teeth have a bit of a yellow tinge to it a lot of the time. So a lot of people want to get rid of that. People that I don't are not allowed to have it, like I said, gum disease, dental decay. If you've got very sensitive teeth, there's a very mild form that we can offer, but if that's giving you sensitivity, then we say, yeah, just don't use it. And yeah, that's mainly the most of the cases where we say no, you can't do the whitening. Very sensitive teeth, a bit of gum recession, as well.
I'd also recommend going to a dental professional because there's a few people that are offering whitening, but they won't be able to check if you have decay. They won't be able to check if you have gum disease. They won't be able to control the gum disease if you have gum disease and you want teeth whitening. So it's best to go to a dental professional for teeth whitening.
Okay. Someone's asked, how often should they visit a dentist?
Yes. Oh, Eliden, actually, sorry, that's your slide. I'll take over.
Yeah, sorry, every 6 months. Simi said, yeah, so twice a year. Some people have to see the dentist more frequently, the dentist will tell you, and some people you actually can be seen once a year, where the dentist will tell you. That's in very rare cases. So for most people, it's twice a year, every 6 months.
Okay.
Sorry, before we go to the next question, I'm
Mhm.
gonna just ask again and plead with you guys to fill out the feedback form so we know how we can best deliver a presentation like this to the next group of people. That would be great. Thank you. Sorry, go.
Wow.
You can
All
go.
right, Latifa, if you can unmute and elaborate on your question about rough sides on the tongue, please, so we can answer that properly. If you can expand on that, ask you to unmute if you're able to speak.
Hi,
Hi.
it's just about having, I don't know how to describe it apart from saying rough edges on the tongue. I think there's a common name for it. I can't remember it right now. But sometimes it's sore, sometimes it's just, it's okay, but the roughness is still there. So I don't know if it's something in particular or it's normal.
Yeah. I'm going to, oh, am I unmuted? Yeah. I want to show you guys a picture actually. See if I can get exactly what you're talking about. So what I'm thinking you're talking about is scalloped tongue, I believe. Let's see
Yeah.
if I can get the image. I just want to be sure. So I put in the chat. Is this like in terms of the edges? Is it like the biting marks of the sides of the tongue? Like, is that what you're talking about?
Yes, exactly.
Yeah. So that's usually due to it's just indentation from your teeth, I would say. If you're very concerned about it, yeah, you can go to the dentist, but this can usually is literally indents from your teeth. I'd say that's what usually causes the scalloped tongue. Yeah, so those scalloped edges on the sides, on the borders of the tongue.
Yeah, it can be a sign of clenching or grinding as well.
Yeah.
Nighttime, some people grind if you're stressed or even overstimulated. Some people grind the teeth at night, and it obviously can catch the tongue. Or day clenching when you're really concentrating, when you're stressing. So it can be a sign of that as well. With that, usually as well, I say go to see the dentist, because we can give you something that can protect your teeth. Because once you're clenching and grinding, if it's affecting your teeth, your jaw, the muscles, you can literally get like a type of arthritis in the jaw, lots of different conditions. So definitely see a dentist, just so we can double check all the other aspects as well that
If it's and if you're noticing it, it might even be quite sore if you're clenching all the time as well. So they might advise a bite guard, so that you're not constantly biting on the tongue and clenching and causing your tongue to be sore due to the clenching, like Dr. Leland said. We hope that helps. Did that clarify?
Thank you.
Oh, no problem.
All right. So someone's asked, what is flossing? And ties up with another question that is it advisable to floss the teeth? And if yes, how many times? So can we explain what flossing is? Not everyone knows what it is, and how many times a day should be floss.
Should I take this?
Yeah, sorry, yeah, you can take. You know, I'm gonna show floss because you said what is floss. I'm gonna see if I can find floss.
Yeah.
Then while you're talking.
Yeah. A lot of people call flossing cleaning in between the teeth. The reason being is because most of the time you use floss, like it's like a string or a tape to clean in between the teeth, remove the food, anything that's stuck, plaque and debris in between the teeth. But a lot of people use that name as a generalization for cleaning in between the teeth. So like I said in the presentation, people with gum disease or some people with gaps that are bigger between the teeth, you actually need to use like an interdental brush, a very small brush that goes in between the teeth. And some people call that flossing as well, but it's not actually using floss, it's using a small interdental brush. You should be doing it twice a day is optimum. But like I said about that evening clean, that clean before bed, you need to make sure you're flossing at least before bed so you can clean all the plaque and food from between the teeth, so it doesn't harbor in the mouth throughout the night. I usually floss first, then I can rinse my mouth, clean my tongue, then I can rinse my mouth, and then I'll brush my gums and my teeth, and then just spit and don't rinse after that. Yeah. Have you been able to find a picture? Oh, you got some.
I've asked you to unmute. You can unmute.
Yes. So I've got some floss here, and I just wanted to show you in terms of how to use it. So you'd wrap it around your middle fingers, basically just like this. And then you put it in between your teeth like that. And then whatever's in between your teeth should come out. So it should just let's say kind of just slide out as you're bringing the floss down in between your teeth. So yeah, if you do that, then you're flossing effectively. But I think Aliden already spoke about how this just cleans in between your teeth, but then the interdental brush actually does your gums. So it needs to be alongside the interdental brushes, which actually get to the bottom of the teeth. This just cleans the sides of the teeth, which gets missed with the toothbrush. So yeah, that's how you floss.
Thank you.
No problem.
So is it true that the color codes on the toothpaste mean something? Do they mean anything? I didn't know there were color codes on the toothpaste. I don't know if Imani can unmute and ask. Elaborate on that. Yeah.
Hello. Yeah, I heard that at the tip of each toothpaste, there are colors, black, I believe, green. I'm not sure the other color, and it means how toxic that particular toothpaste. So if it's green, then it's less toxic. That's what I've been seeing on social media and things like that. So I don't know if you guys have any idea about such things.
Any idea, guys?
No, I'm not aware of any indication of toxicity from the marks. From what I know, it's more manufacturing thing. But yeah, usually I've not heard of any indication from toxicity from color codes. Like I said about the fluoride thing, it's say on the back of the tube in terms of how much. All the other ingredients should be listed on the tube as well. Usually ingredients, the first ingredients that show on the tube, that's the ones that have the most in that product. So yeah, I'm not aware of that.
Yeah, me either. I appreciate it.
Okay. We don't know. Here's the answer. All right, next question. What should one do when the gums bleed when brushing? This person may have probably joined later when we had already spoken about this, but just you can just answer briefly again. What should one do when the
Sorry,
gums
what did
bleed
she?
when brushing? What should one do when the gums bleed when brushing?
Okay,
Oh, I don't know.
I found this on the web for what it.
Not Siri, Austin. What's been the question? Sorry,
No,
Lydia,
try to answer the question
you
first.
imagine. Oh, imagine. Lydia, do you want to?
Yeah.
Yeah.
Yeah, if you see bleeding whilst you're brushing, it's a sign that the gum's inflamed in that area, which is a sign that there's bacteria in the area. So actually don't stop brushing. Keep actually brushing that area. You don't need to be hard, don't be brushing it hard, just with the right technique that we went through earlier. So keep brushing the area, don't stop because you see bleeding. You can do warm salt water rinses to help any inflammation, help it to calm down and heal. And also visit your dentist or hygienist because it's likely you'll need some professional cleaning, dental treatment to get under the gum and reach areas that your brush can't actually reach to. So yeah, bleeding is a sign, that something's going on. Healthy gums don't bleed, but don't stop brushing or flossing because you see the bleeding. It's an indication that, oh, there's bacteria here. My gum is inflamed. Therefore, you actually should clean that area more. Pay attention to that area.
Yeah.
Okay.
Sorry, I just wanted to speak about the color coding. Depending
Yes,
on where
I was
you
gonna
get,
say, yeah. Go on.
yeah, depending on where you get the toothpaste from. So some people go to the pharmacy for toothpaste. If you go to the pharmacy, the pharmacist, I know there's pharmacists in the chat, but they might have more information in regards to, I don't know, the color coding of toothpaste. Maybe if it's sold in the pharmacy. But yeah, it might be a manufacturing thing like the person has put in the chat. But yeah, we're so sorry we can't. We haven't. I don't think I've come across a color coded toothpaste. I've come across color coded and incidental brushes, but not toothpaste.
That's for different sizes anyway, the color codes, right?
Yeah, exactly.
That's different. So
Yeah.
yeah, Dr. Simi, pharmacy will not know either. So
Really? Would you say?
as the person said in the chat, it's just probably to do with manufacturing and
On the tube, it's in the end of the tube.
Yeah, so it's probably for their own purposes in manufacturing or something like that.
Yeah, I don't know. Yeah,
thank
sorry, I
you.
was thinking.
Samsung, you didn't change your name, so I can't say your name. Thank you for putting that in the chat. All right. Where was I? Okay. Motorola. Sorry, that's the name on the screen. You had a question about TMJ. I don't know what that is. Do you want to unmute and ask your question? You mentioned, yeah, go on. I've asked you to unmute. So the person said, you mentioned TMJ at the beginning. And my question is about TMG. Is it making sense to you guys?
Yeah.
Okay, good. It's very difficult to get a referral. What can she do? She's suffering a lot. Is there any, he or she?
Okay, so TMJ stands for temporomandibular joint. So it's pretty much around here. And so when there's issues with this joint, yeah, people can have maybe some pain, that you might hear some clicking or crunching noises as well. You need to go to the dentist. And most likely they'll refer you to someone who specializes in like head and neck things, so the oral and maxillofacial department. Usually it'll be another referral from the general dental practitioner if they feel that they can't manage things in general dental practice. So definitely go to the dentist if you're in pain. That shouldn't be the case. You shouldn't really be suffering in silence. Do go to the dentist. This is actually quite common as well. If you're clenching, sometimes it's if you're clenching, you're constantly working these muscles around the joint. So if they're overworked, sometimes they actually get pronounced as well. So your muscles will, some people have like a wide jaw due to a lot of clenching or grinding and things like that. And that's another sign that there's something going on. But pain, as I said, shouldn't be the case. Do check if you're grinding or clenching a lot, but just definitely see the dentist so they can examine you properly.
I think they said they're waiting for a referral. Is that right?
Oh, sorry, I didn't read the rest of it.
Yeah,
Sorry.
they said it's very difficult to get a referral.
Oh,
Referral from the dentist. Did they
NHS
say?
referral, yes.
Have they gone to the doctors?
I don't know. Motorola,
Oh.
you need to just
Oh, sorry, yes,
unmute
Motorola.
or put
Yes.
some answers in the chat if you want some more support with that. Okay.
Yeah, go to the doctors as well if you really can't. If it's there's an issue with going through the dentist.
For the time being, you can use warm compress or cold compress around the joint. So we're talking about the joint that is the joint of the jaw, right? So you just place it around just in front of the ear by the cheek. And you can try warm compress or cold compress, whichever feels better in the area. Make sure you have a soft food diet. There's also ibuprofen gel. So rather than the tablets, there's a gel, and you can literally rub it around that area. That can help to relieve the inflammation, pain, from the muscles and things like that. There's some exercises as well on YouTube. Type in TMJ exercises. The NHS has some good videos on what to do. It's just all about decompressing that muscle and that joint to help it relax, because you're likely getting the pain from the inflammation and the stress on the joint or on the muscles.
Yeah.
And then NHS, there's a long waiting list for a lot of the TMJ referrals. You can go privately, separately as well.
Yeah.
Okay.
I'd say stifling.
Sorry, Dr.
Oh,
Simi.
no, that's fine.
I don't want it to become a individual personal thing. Yeah.
Oh, I see. Okay.
Yeah.
Okay.
Thank you. Because we don't have the full history. But yes, I think that information you provided should be helpful for the person asking. All right, let me read this feedback. Fantastic presentations from both speakers. I feel officially enlightened! Exclamation. This webinar has really opened my previously very ignorant eyes. I'm now booking an appointment with my dentist and retiring from all future self-diagnosis effective immediately. No more me as a DIY dental assessor, Biko. That's what that's really that. So thank you.
Yeah, no problem.
So we know that it's having impact already. Next
good.
question is, what are the most cost-effective and comfortable options to replace a tooth that was surgically extracted? Implants, bridge, what are the options?
Aline, do you want to?
Yeah,
I'll cover some others. Yeah, I feel like
there's other options. Implant here in the UK, it's on a private basis. Usually that would be your best option, just because it's permanent, it goes into the bone. You don't have to be removing it. And secondly, a bridge is an option, but that's based on the condition of the teeth either side of your gap. So they have to be in suitable condition for a bridge to work. So some people might not be suitable for them. And then the other option is a denture. So that's the one that you remove, the false teeth that you remove every night. And those are, the main options for replacing a gap. You can leave the gap in some cases and do nothing. It just depends which tooth is missing and if you can function okay without that tooth being there.
Okay. Anything else, Dr. Simi? Oh.
No, I think I was just I was just kind of looking at the sorry, I put something in the chat just to help that person for the time being. There's the word shame, that's what we use in regards to, sorry, that last person. So I've just left that there.
Okay,
For them
that's
to
fine.
read, if that makes sense. Yeah.
Yeah, thank you. So let's talk about braces. Cleaning issues, any advice about braces? People who are using braces, young teenagers, adults, and so on. Is there anything specific you'd like the audience to know who are using braces? Any issues you see that will occur that should not be occurring?
Good question. You should still see the dentist if you've got braces. Interdental brushes can clean in between the braces, so it's good if you use interdental brushes around the brace. So the brace brackets, which is the squares, the metal squares that are found on the teeth. So using the interdental brushes. Diet has to be, you have to be very firm with diet. If you're eating hard foods, for example, that can actually cause damage to the braces. And you know, the dentist may need to, sorry, the orthodontist may need to kind of stick the bracket back on your teeth, for example. Yes, it could be damaging to your brace. Yeah, I think that's pretty much it. Sometimes the brackets can cause damage to the inside of your cheek, for example, something like that. Just go and see a dentist. If you're going to see the dentist and the orthodontist often, then they'll be able to see any problems, or they might advise you on how to, you know, maintain your oral health as well. But your oral hygiene has to be fantastic when you have braces, and they'll only give you braces once your oral hygiene is fantastic, because it makes it harder to maintain good oral health when you do have braces. But yeah, sorry, I hope that's helped.
Ellie, doing anything?
Yeah, no, literally it's that thing about keeping it really clean. Be really meticulous, and if you're a parent, really watch how your children are cleaning. Get underneath the brackets, on top, the back, everywhere. It's so easy to miss the plaque because it sticks around the braces. So yeah, be really good with the cleaning.
Yeah, and aesthetics wise, when you get the braces off, it's very evident if you've been brushing properly or not.
Yeah.
So there'll be some, yeah, it will look like discoloration, but it's literally the areas that were covered with the bracket would be like the clean areas, or like the whitish looking areas, and then everything around will be looking yellow. So if you want your teeth to look uniform, definitely be good with brushing and things.
Okay. Last question, I think. If you have any more questions, please pop them in the chat or raise your hand while I take this one. Is the use of toothpicks advisable?
I would say based on research, there's a lot of studies to say that toothpicks are not as effective as floss and interdental brushes. I remember I actually did a study. I did research in my university paper. I had to, not a paper I had to write, but I had to do like a review on some papers that spoke about this. And I found that toothpicks can actually be quite damaging to the gums. And I would say mainly due to the material, but with floss, you can actually get in between the teeth and you know, get the debris out in between your teeth. And with the interdental brushes, you're actually scrubbing in between your teeth. It's got the bristles, so it's more effective in terms of getting food between your teeth out. So I wouldn't recommend toothpicks. I know it's easy. You have it in your cupboard. Most people have it in their cupboards and everything. It's easy to reach, but I would say the interdental brush and floss is more effective.
I've just had a look at the feedback form. Only 7 people have completed the feedback form.
This is not good.
Please do that.
Guys, please.
Yes, there's actually a question on the feedback form, which I'm gonna for us to take now.
Interesting.
The person said, I have loose teeth because of gum disease. Is there anything I can do? Can I put braces? And also, how do I straighten my teeth? Thank you.
We wouldn't recommend braces. I would say we wouldn't give you braces
Yeah.
for loose teeth. You need to go to the dentist or a hygienist, a dental hygienist, so that they can control. It sounds like you have severe gum disease. They need to control the disease before even doing anything And I don't know how loose your teeth are. It depends on how severe the gum disease is. That will determine if teeth can stabilize a bit. Sometimes if you if the gums are stable health-wise, and so they've been cleaned, yeah, you've had a thorough clean at the dentist or the hygienist, then your gums can tighten a bit around the teeth, but the bone doesn't grow back. But yeah, it can slightly stabilize your teeth a bit, but you do need regular visits for a deep clean at the dentist. But definitely just go to the dentist so they can assess how severe the gum disease is and that they can control the gum disease so it doesn't progress. Sorry, Needham, I don't know if you want to add.
Yeah, and I think just like we mentioned in the PowerPoint, that's the issue with gum disease, having mobile teeth. If the teeth are too wobbly, there's not really much we can do. You'd have to have it removed, and then you think of something to replace the gap. So that's if it's at quite a severe stage. And yeah, you just have something to replace the gap, which would sort of close the gaps.
All right. Now, there's another question on feedback format. How to remove and prevent tartar? Is that the same as plaque?
Nice.
So tartar,
Yeah.
in other words, calculus, is actually hardened plaque. So over time, if plaque hasn't been cleaned, it tends to harden. So the calculus would be just a mixture of, yeah, the food that you've been eating that hasn't been cleaned with a toothbrush. And then it would just tend to, I think it was in Yoande's video as well in regards to what it looked like, but it's literally just hardened plaque that you can't actually brush away with a toothbrush. So you actually need to go to the dentist to get that cleaned. It doesn't come away with a toothbrush. So it's mineralized. There's minerals now in this plaque, which helps to make it hardened. Yeah, I don't know if you want to add anything.
Yeah, it's like that yellow hard. A lot of people get
Yes,
back of those bottom front teeth. It's calcified plaque from the
calcified, sorry, yeah, calcified plaque.
Okay. Any questions or comments from the audience? Any other dentists in the house? Raise your hand. Is there anything you would like to add or contribute? I haven't got any more questions here. If anyone has any more questions. For our wonderful dentist here.
And please do fill out the feedback form. There's 30 people in the
All
call.
right. Someone asked, what of using baking soda, lime, and salt for teeth whitening? Any thoughts about that? Baking soda, lime, and salt for teeth whitening.
I'll just say lime is acidic. Lime is acidic. It's gonna affect your it's gonna damage the substance of your teeth, especially the outer layer. And it may look white because you are damaging it's like the how will I explain it? The salt as well is kind of abrasive to the teeth, so it's quite harsh for the teeth. So if you're doing acid as well as this harsh abrasive substance, you're adding that to your teeth, it's gonna look white. And baking soda, don't get me wrong, it will look white, but it's because you're destroying your teeth. You're removing that layer and destroying the layer of your enamel so that there's a new layer of enamel, which looks white, but is actually damaging your teeth.
Yeah, it will when you do that for a while, you'll get sensitive teeth.
Yeah.
Eventually as well, that enamel layer is gonna go.
Yeah.
And that second layer, which is what Simi was talking about, the dentine, which is yellow. Now your teeth will be yellow and it won't go back to white because you can't get the enamel back. So yeah,
just with teeth whitening, but yeah.
Not recommended.
Okay. Oh, let me see. Thank you. I can see the 11 responses now. Thank you. It's going up. Turmeric. Can turmeric change the color of your teeth? Person is saying since adding turmeric to her teeth, she's noticed that her teeth look more yellow.
Yes.
Yeah.
I didn't know if you wanted to talk. Yeah.
It's usually though, it should usually just be a sort of surface extrinsic staining. So you just sort of need a bit of hygienist visit and polishing, and it should come off. But it can, if you some areas of the teeth, if you've got a bit of gums that have receded, it can stick a bit more to those areas as well, which might be a bit more difficult to come off. But yeah, that would be usually the reason why your teeth would be looking more yellow.
What other things can stain your teeth? And would you say it's a matter of going to the hygienist that it will come off? Are there some stains that will not come off?
The extrinsic stains, which is usually from foods and drinks, usually will come off with a hygienist clean. Intrinsic stains, with staining that's from the inside of the teeth. Usually it's from when the teeth are developing, or if you've got a condition with the teeth, then that won't come off from a hygienist clean. Other things that can stain the teeth, like curries, that's mainly the turmeric. What else? Wine, red wine, coffees, teas can stain as well. So yeah, you can use a straw and kind of don't swish it around the teeth, kind of just try and swallow, so it limits the amount of teeth that surface that it touches. Having a lot of water afterwards to try and, rinse it off. Yeah, that would be my main sort of recommendations of what you can do to help manage any sort of staining, and then see the hygienist once or twice a year. They can get off any stains that are not coming off.
Wow, thank you. Oh, someone's just asking, please give us information about dental implants in future meetings. That would be a whole webinar on its own.
Definitely.
Okay.
Laura, you might have to invite an implantologist for that. We don't have any experience with dental implants. But yeah, we just know what kind of mouth shouldn't have dental implants.
Yeah, anyway, you'll give me the contact for that. We'll look into that.
Yeah.
Thank you. All right, everyone. Any more questions before we let our fantastic dentist go and rest for the weekend? Any more questions? Any more comments? Please fill in the feedback form. I've also posted the link to the recording on YouTube if you want to watch this again and share with other people. If there are no more, thank you for filling in the feedback from those who've done it. If there are no more questions, no more comments, another thank you from someone in the audience. Thank you so much. Excellent session. Let's just show our speakers some appreciation one more time. And with that, we'll say, have a good evening. Thank you. Yes, thank you. Thank you. Awesome. Thank you.
Thanks, Flora, as well.
Thank you.
Facilitating.